Okay, buckle up because I've got an intense story for you today for an update. I went to the specialist this morning. I'm going to show you what my leg looked like yesterday. So you can see my kneecap and then you can see that giant bump underneath it. That was my hematoma. So that's what we were dealing with today. Hold on. This update is going to have a lot of disgusting details. So if you are not into that, if Dr. Pimple Popper is not your thing, then you need to keep scrolling because this is pretty gross. So I went and they noticed the giant size of my hematoma. He said that hematoma right under my shin was keeping it where that's why my foot was so swollen, because normally your body, as you walk, it will kind of circulate fluids naturally in your body. Well, that hematoma was kind of blocking it where that circulation couldn't naturally happen. So he gave me three options. First option was just let it ride and see how long it takes to go away, which could be months. 2, use a needle to suck that out, but it could be a little bit difficult because he said it's thick clotted stuff. And so it's like drinking a thick milkshake through a tiny straw. Or my option 3 was to do surgery. So I told him to go ahead and try option 2 using the needle because I just wanted to see if anything would happen today to provide a little bit of immediate relief. So here's where things get gross. He took the biggest needle that I've ever seen in my entire life. And well, first he numbed the area with some numbing spray and then he gave me some lidocaine. So then he took this needle and poked it into the hematoma and started sucking out nastiness. Like it was thick, dark reddish brown, clotted stuff. So then he was sucking that out and he was kind of doing like this kind of motion to like suck it out. And he ended up getting a lot. He poked it a few times in a row with the needle to kind of almost make it like you would use a scalpel to cut open. And then his assistant was pushing on it and getting stuff to kind of squish out. They got like 35 to 40 milliliters of junk out, which provided me with immediate relief in that way, but it did kind of throb all day. So he told me to keep a hot compress on it today, and it's going to continue to drain for the next 24 to 48 hours. In about 2 weeks, we're going to reevaluate. If it hasn't gone down, then I'm going to move to the surgery option because it has provided a lot of relief pressure-wise already. So I'm hoping we don't have to do that, but I will if necessary.